This DVD will demonstrate to the student how to correctly perform a spirometry. With the combination of this DV and your manual, you will understand how to correctly perform a spirometry and how to eliminate causes of poor patient performance. Spirometry means measuring breath and is the most common of the pulmonary function tests. It measures lung function, especially the amount and speed that air can be inhaled and exhaled. It is performed to assess the cause of shortness of breath and to rule out any kind of obstructive disease that blocks breathing or restrictive diseases that limit the expansion and capacity of the lungs. It can also be performed for a number of reasons that may include pre-assessment for people wishing to learn to scuba dive, pre-employment assessment, routine pre-operative assessment, assessment for lung capacity in people with chest infections, asthma, emphysema, or smokers, to assess lung damage caused by injuries, or to monitor how well medications for respiratory problems are working.
Doctor has ordered a test today to see how well your lungs are working. But before we get started, I'll need to ask you a few questions. Okay? Do you take any medications to help you breathe?
I take Ventolin.
And when did you last have that?
About 6 hours ago.
Excellent. Have you had any recent chest surgery or heart attacks?
No.
Are you pregnant?
No.
And do you suffer from chest pain or heart disease?
No, never.
First thing we'll need to get you to do is obtain your height and weight. I need to pop this information into the machine. Okay?
Sure.
I'll get you to slip your shoes off and remove anything heavy from your pockets. A little bit to the left. Excellent. Now I'll get you to stand on the scales.
Known asthmatics are usually prescribed an inhaler, a device that administers a measured dose of drugs inhaled directly into the lungs, where it will have a near instant effect. Inhalers for prevention are generally brown, and inhalers for the relief of attacks are usually blue. If a patient has taken their relief puffer, we must wait 4 hours before we do the test. How is spirometry performed? A spirometry test is done with a spirometer, which consists of a disposable mouthpiece connected to a machine that records the results and displays them on a graph. To perform spirometry, a person inhales deeply, closes the mouth tightly around the tube, and then exhales through the tube while measurements are taken. Some test measurements are obtained by normal breathing, and other tests require rapid and forceful inhalation and/or exhalation. The volume of air inhaled or exhaled and the length of time each breath takes is recorded and analysed. Nose clips are usually used to make sure the air is only coming out of the mouth. Sometimes a test will be repeated to get the best and maximum effort. Often the tests are repeated after a person takes a medication that opens the airways of the lungs, a bronchodilator. This is called pre- and post-BD spirometry.
It's important to remember that the spirometry machine must be unplugged from the wall before use. And it is also very important to remember to make sure the spirometry is fully charged at the end of each day. I'm just going to enter your information now into the spirometry machine. I'll just give you a demonstration. Pop the nose peg on, a really deep breath in, until there's nothing left in your lungs.
Remember, particularly in patients with airflow obstruction, that it may take many seconds to fully exhale. It is also important to recognise those patients whose efforts are reduced by chest pain or abdominal problems, or by fear of incontinence, or even just by lack of confidence.
Excellent. We actually use disposable filters that we throw away after each patient, okay? Let's pop one on for you. Okay, so what I'll get you to do, place your feet flat on the ground and sit nice and straight. Pop the nose peg on. Okay, excellent. I'll get you to hold on to this for me. Take a really deep breath in and blow. Keep going. Well done. Okay, and I'll get you to perform it again. Okay. Keep going until there's nothing left. Excellent. I'll get you to do another one so the machine can choose the best one. Okay, really deep breath in and blow. Excellent. Keep going until there's nothing left. Well done. I'm just going to give you some Ventolin now, then we wait 10 minutes and repeat the procedure all over again. Okay? Okay, so this time what you need to do is pop your lips around the cardboard and take 2 big breaths in when I tell you. Okay, big breath in, out through your nose. Breathe in again. Excellent. And I'll give you another squirt. Big breath in, out through your nose, and one more. Fantastic. Okay, now I'll just start the timer for 10 minutes. Now that the 10 minutes is up, we need to repeat that procedure all over again. Okay? Just pop your nose peg on. Sit up nice and straight. Fantastic.
There is no substitute for careful explanation and demonstration. Demonstrating the manoeuvre to the patient will overcome 90% of problems encountered and is critical in achieving satisfactory results. Observation and encouragement of the patient's performance are crucial.
Now that the test is all finished and the information is printed out, you're free to go. Okay, have a nice day.